Okay. Yeah, we have in the skills lab many kind of hospital where we train students for the purpose of clinical rotations, so that before we take them to the hospital, we train them, they acquire the skills, and then we take them to the hospital level. We have several skills that they can learn in the skills lab. For the purpose of this demonstration, I'm going to take you through the drug administration, how to administer the drug. Yeah. Can help me? This is our patient by name Mohammed Hassan. Want to do the drug administrations. Specifically, we have got several routes of drug administration, which can be classified as IM, intramuscular, IV, through the intravenous. We have got an oral drug administration. For the purpose of this demonstration, we're going to do IM, intramuscular drug administration. The site of drug administration for IM, we have got three parts, one at the deltoid region, at the thigh, and then at the back, gluteal one. We're going to do the deltoid one. First of all, you have to greet the patient, explain the procedure to the patient. For the purpose of time, I want to summarize. So, to do the drug administration at the deltoid region, help me here. First, you clean the site. This is for purpose of preventing infections. Then, here, the scapula.
My lecturer nurse, and with me are my students. On my left is Kemboy Kibet, who will be helping me in documentation, and on my right is Salma Ali, who will be helping me in terms of acquiring some of the equipment that I will use. Before you use a patient that have problem with bladder incontinence, maybe as a result of condition or health-related condition, or even growth within the roots that the urine pass, they may get obstructions, and this will lead to blood accumulation in the bladder. So when a patient develops such conditions, we have a procedure for them, and that procedure is catheterization. So we have the equipment here. We are avoiding it as a result of, the exposure of private part to so many people. So as a result of privacy, we covered it. But the bladder is in situ, it is in place.
For the purpose of privacy and so on. Then we start with something called inspection, where we inspect the patient as a whole and the chest as a whole. So on the nose, we check something called nasal flaring, which is the widening of the nostrils in case of increased breathing. Then we check for cyanosis. Cyanosis is basically the bluish coloration due to low oxygen, and so on. We come to the chest. So the chest, we check how it is moving, chest movement. We check for any deformity. We check for any scars, whether it is surgical or whether it is therapeutic marks, and so on.
I want you, as students in the health space, we not only have opportunities for you to work for us in Kenya, but also know that you have opportunities to work globally. We have made adequate arrangements so that if you want to work anywhere in the world, the education you are acquiring in Mandera KMTC is able to take you anywhere in the world because it is world-class. Mnanielewa? It is world-class education. The same way you will train here and graduate from here and work in our hospitals, you are also capable of working in any other health facility in the world. And we are providing that training. We have been discussing with the management of KMTC. We know what we need to do to be able to improve on the teacher-student ratio in our KMTC, to be able to have additional equipment for proper training in our KMTCs. And it is my intention and plan to make sure that we support all our KMTCs. Tumeelewana? So mimi nimefurahi sana kufika Mandera. Many of you who come from different parts of the country. We've also been discussing with leaders how we are going to develop the road from Isiolo all the way to Mandera to make sure that it is motorable, it is in good condition so that we can connect this part of Kenya to the rest of Kenya.